Good morning or good afternoon to everyone. Welcome to today's online presentation, Ensuring Equitable Healthcare Through Interpretation from Concept to Practice. Now, before we begin our presentation today, we would like to make an acknowledgement that N4 is hosted at CHEO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Andrew Tomeyer. I'm N4's Education Coordinator. I will be hosting and moderating today's presentation. Alongside myself, my colleagues and co-host Mariah Maddock, Team Lead of Knowledge Generation and Mobilization, and Colleen Drake, Engagement Coordinator, will also be here monitoring the Q&A box, as well as any technical elements in the background today. I'm now pleased to introduce you to today's presenters. I'm going to ask that you turn on your video as I introduce you. Jocelyn Lamont is Patient Experience Specialist at CHEO and has spent many years working with children, adults, and families as they navigate the healthcare system. She began her career as an RN, became executive director of a not-for-profit organization, and is currently a proud member of Team CHEO. As a member of Patient Experience Team at CHEO, she works passionately to get appropriate supports to those in need when they need them the most through family support services. Jill Sullivan is the Manager of Patient Experience, Patient Safety, and Risk at CHEO as well in Ottawa, Ontario. She has worked at CHEO for over 18 years, starting off as an RN in the emergency department, and then moving to Patient Experience 4 years ago. Most recently, Patient Safety and Risk was also added to her portfolio. Jill wished of being a pediatric nurse since she was 4 years old, and so the opportunity to work with children, youth, and families at CHEO was really a dream come true. Developing ways to enhance their experience and support their journey is one of Jill's passions. The patient experience team's work with the interpreter services at CHEO is just one of the ways that she's able to do this. She feels very lucky every day to work with such a great team, families, and interpreters. As well, Catherine Penny, Quality Improvement Specialist at N4, is an experienced policy analyst and researcher. Driven to improve social equity through policy, she takes pride in providing an intersectional approach to stakeholder engagement. She's worked in federal ministries where she advanced policies to improve equity for vulnerable populations. She has a Master's of Public Policy and Administration and a Bachelor of Arts in History, Political Science, and Indigenous Studies. Catherine brings her experiences and her passion for N4's vision in creating a consistent and equitable experience for newcomers to her work. Her role focuses on the implementation of our monitoring and evaluation framework and our community practice steering committees and working groups and many other elements of N4. Welcome. For some housekeeping, today's session is being recorded and will be uploaded to N4's platform within about a week or so. We will share this with you as soon as it becomes available. Should there be any technical issues during this presentation, we will inform you with details for an alternate makeup session. And before we begin today's event, I would like to take a moment to introduce you to our platform features here on Zoom to help enhance your participation experience. Throughout today's session, we invite you to write your questions in the Q&A window. And we know that sometimes many of you might have the same question or be interested in a particular response to a question. So you also have the option to upvote questions that you would like to hear the answer to. Please upvote them, and we will prioritize which questions we pose to the speakers first. And with that said, let's jump right into today's presentation. Our speakers have no conflicts of interest to declare, and so I will pass the virtual podium over to our presenters, first with Catherine, and then followed by Jill and Jocelyn. Take it away, Catherine.
Thank you very much. My name is Catherine Penny, and I will be here today to talk to you about access to interpretation and how N4 became involved in this work and how we continue to advocate for this health equity issue. N4 leveraged its community practice model to create a working group on access to interpretation. The role of all of N4's COP work is to address the root causes of inequities for newcomers in accessing health, social, and settlement services. The Access to Interpretation Working Group met from November 2021 to March 2022. It was co chaired by Tim Holland, a physician in Halifax, Nova Scotia, at a newcomer clinic, as well by Alana Carlisle, a manager for language access and equity at Shared Health Manitoba. The goal of this work was to establish guidelines for healthcare interpretation, which can be implemented nationally to ensure equitable access and experiences with health and social services. On the screen now, you'll see a timeline of this work. As you can appreciate, we began by doing preliminary review and environmental scan on the topic of access to interpretation. We understood the costs and benefits of providing these services. We then gathered our working group and met a total of 4 times. And at the end, we had our result, which was our deliverable on a position paper. What is really key about this working group is how we brought together subject matter experts to a time limited table. As seen, we met 4 times, and at the end, we created an evidence based, outcome driven, and impact focused product titled Pan Canadian Standards for Healthcare Equity: The Case for Provincial Interpretation. And this deliverable calls for a safe, equitable, and positive healthcare access and experience for newcomers through establishing provincially funded access to interpretation. As you can see, we're currently at our knowledge mobilization, where we continue to mobilize this work and advocate. Now, on to the topic of access to interpretation. This issue is a serious healthcare equity issue. The federal government continues to rely on immigration as a key economic strategy for Canada. As our country continues to diversify, so do our patients. Without the ability to communicate with a care provider in a preferred language, patients cannot engage with healthcare providers. A wealth of data shows that when a professional interpreter is not present, family members, friends, and staff are often called upon as ad hoc interpreters. This can lead to medical errors, parentification of children, and a lack of understanding and therefore adherence to treatment plans. It also is very inappropriate to ask family members, friends, or staff to become interpreters for patients. Perhaps information may not want to be shared due to the closeness of their relationship. Although this is a serious health equity issue, we also understand that the impact of not having access to interpretation is also damaging to providers. The Venn diagram highlights that administrative burden and the lack of centralization all results in time and money wasted for providers. And these are two things organizations do not have a surplus of after the impacts of COVID-19 and after our ongoing HHR crisis. The Pan Canadian Standards for Healthcare Equity calls for governments, and specifically provincial governments, to fund a centralized interpretation as it is an essential foundation to healthcare delivery. It is very important that access to interpretation is prevented at the federal level. First, it allows a centralization of services. This is key for all points of care from hospitals to clinics will have to have access to interpretation. And currently, in many provinces across Canada, the onus is on organizations themselves to provide that funding and provide that service to their patients. If it was centralized within a province, all organizations would be able to have access to interpretation. Second, it is very important that professional interpreters who are trained are offering this service. It is inappropriate to rely on family, children, or settlement workers to provide medical knowledge to their patients. Lastly, it must be virtual, over the phone, and in person, as this will promote usability, credibility, and reliability across the province. Since the launch of our position paper in March 2022, the paper has been viewed over 2,000 times and downloaded over 800 times. We presented at a Healthcare Excellence Canada patient engagement table, and we're very happy to announce that multiple standard organizations have been reached out to create and implement a national standard. Health Standards Organization, HSO, has incorporated access to language interpretation into over 35 of their standards, in particular under their equity, diversity, and inclusion portfolio. This is a great step into ensuring access and safe care for all newcomers. Healthcare Canada has also developed a policy brief and shared our work with their members. In terms of the work N4 has been doing, we have developed a government relations strategy to further our advocacy. We've connected with governments across Canada from BC, Alberta, and Saskatchewan, and in particular have met with 10 members of parliament from these provinces. We've also connected with the National LIPS Secretariat and presented our work on access to interpretation to them. We've presented to the Saskatchewan Party Caucus, Health Quality Council of Alberta, Provincial Language Services in BC, and to the Government of Manitoba, in particular, their ADM of Health Policy and Planning. And this was all to support the work that we have done on advocating for access to interpretation. On the screen now, you're seeing a two-page communication document we created to really provide a high-level overview of this issue. And we've been sharing it with politicians at the federal and provincial level to increase their awareness of this issue. We're often asked during our conversations on this topic, what can we do? And this question sparked our advocacy letter. We encourage you to read this letter and share it within your network. The letter is addressed to provincial ministries of health and highlights the issue of access to interpretation, and we explain how a provincial government can ask for funding on this issue. The Government of Canada recently announced that it would provide over $25 billion to province and territories to support shared health priorities through tailored bilateral agreements that are underpinned by key priority principles. And one of those key principles is equal access for equity-seeking groups and individuals. We explain this in the letter and encourage politicians to take this recent announcement into their consideration and use it to help fund centralized access to interpretation. We really encourage you to distribute and download this letter. It is available via the QR code on the screen. That will take you to our landing page that has all of our resources on access to interpretation. It's currently available in English, but will shortly be available in French. And as I said earlier, it is a template letter, and you're able to fill in your information into the letter. Lastly, we encourage you to download and distribute our work on access to interpretation, to use our template letter, and to connect to ethno-cultural communities in your areas to discuss this topic. And of course, if you have any questions, please reach out to the N4 team, as we're always happy to meet and learn more on this issue. Thank you very much. And with that, I can pass it over to Jill and Jocelyn.
You so much, Catherine. Great presentation. That really ties in nicely with what Jocelyn and I are going to be talking about. Because we're going to take a bit of a deeper dive into what an interpreter program could look like and some tips and tricks in working with interpreters in your organization. Just get ourselves set up here. All right, I think everybody should be able to see the screen. Jocelyn, a head nod if you can see that. All right, thank you. So good afternoon, everyone, and thank you for having us today. My name is Jill, as Andrew mentioned at the beginning. I'm the Manager of Patient Experience and Patient Safety at CHEO in Ottawa. And with me is Jocelyn Lamont, who coordinates our interpreter services program here with me at CHEO. Today, we're going to be presenting a little bit on CHEO's interpreter services and how interpretation can improve patient care, as Catherine stated earlier. We hope this presentation is helpful to you and your organization, and we really look forward to hearing and learning from you also about your programs. So please share your thoughts and experiences as we move through the presentation. So at CHEO, we like to start every meeting or presentation with a safety story, and this reminds us of the importance of patient safety and all that we do here. To get us started today, we thought we'd share a patient safety story that really highlights the importance of interpreters in a patient's visit. And this is loosely based on a patient who received care from CHEO last year. We hope you find it meaningful.
Apologies, Jill. You just have the presentation side showing.
Oh, thank you. Now, Andrew?
That's good.
Okay.
This is the story of A. A is a patient born in December of 2022 with a complex cardiac condition that required life-saving treatment after birth. A was admitted to CHEO post-op for 2 weeks while recovering from their surgery. Upon discharge, A's parents were given an after-visit summary that contained important discharge instructions. This included information on medications, feeding schedules, and follow-up appointments. The discharge summary and verbal instructions were provided to the family in English. A's family were newcomers whose first language was Arabic. 2 weeks after their discharge, A was brought back to the CHEO emergency department in respiratory distress. A was diagnosed with an aspiration pneumonia. An interpreter was used throughout the visit to communicate with the family. It was discovered during the ED visit, with the help of the interpreter, that A was not receiving the correct amount of anti-reflux medication, nor were they receiving the correct amount of nutrition during their feeds. It is suspected that the larger volume of feeds being given and A's mistreated reflux resulted in the aspiration pneumonia. A required a second admission during which they received IV antibiotics, oxygen, and supportive care. A's story is an example of the impact an interpreter can or cannot have on a patient's safety and their experience with the healthcare system.
So we thought that story really nicely highlighted the impact that an interpreter can have on safety and on patient experience, and really the importance of having interpreters involved in patient care. So over the next 30 to 40 minutes, we're going to spend some time discussing with you the need for interpreters, what our interpreter services program looks like at CHEO, the benefits of interpreters, and then some tips and tricks for working with interpreters. And please feel free to ask questions along the way, or feel free to share your experiences. We're going to start with a quick poll. And so our first question that we have for you is just, does your organization currently have an interpreter services program? Yes or no question. We do an Andrew.
We have about 83% of the attendees. Would you like me to stop the poll?
Sure. Thank you very much. Okay, great. Great. So it's great to see so many of you already have interpreter services programs in your organization. And for those that don't, we really do hope that this discussion provides reasons why one is valuable to you and your organization, along with providing you some suggestions on how to build a successful program if one is being considered with your organization. So why the need? Catherine talked a little bit about this at the beginning, but why is it important that we each have an interpreter program that supports teams and families when receiving health care? As you can see from the graph, there's been a gradual increase in the number of immigrants in Canada, with a large spike in the last 2 years. This means more newcomers who need language and cultural supports. And this is even more important when newcomers are receiving health care, as this is when we are all at our most vulnerable. So this quote's a bit older, but really highlights that providers cite their reason for not using interpreters to be that they lack the training on how to access them, work with them, and they also find it a bit of an inconvenience to use them. They also mention the fact that they underestimate the risk of using ad hoc interpreters. And the next video, the video we're going to show right now, provides an example of that. So.
ማታ ደግሞ ትናንትና ብዙ ጠጣችሁ እንዴ?
አይደለም እሱ አይደለም እባክህ ያመኛል በጣም ቁርጠት።
እስቲ እንግዲህ ዶክተሩ ይመጣል የሚለውን እንሰማለን። እኔ ግን ምናልባት መጠጡ አብዝተህ ሊሆን ይችላል።
ኧረ መጠጥ አይደለም እባክህ።
Hey, how's it going? Just here to check see how you're going today, and then let's get some paperwork filled out and get you out of here, okay?
ምንድን ነው?
He doesn't speak English. I'll interpret for him.
Oh, you sure? I mean, I guess I could call our interpreter, but since you're here and you know him, maybe we should just go with that.
Yeah, I interpret for him all the time, so it's fine.
Sounds great. Good morning. How are you? I'm just gonna ask your brother some questions about how you're doing.
መጀመሪያ
ስላንተ ሊጠይቀኝ ነው እኔ እነግረዋለሁ።
So can you ask your brother how he's doing today?
Yeah, he's fine.
Does he have any problems at all? Like, why is he here today?
ዛሬ ለምን መጣ እዚህ ነው የሚለው።
በጣም አሞኛል
It's like
በለው።
maybe he has a little gas or something.
ራስ ምታት አለኝ ምናምን እና በጣም ነው የሚወጋኝ።
Yeah, still some little gas.
Maybe a little gas. Okay. Does he have any past medical history, any medical problems at all?
ድሮ ታመህ ታውቃለህ ወይ በሽታ ይዞ ያውቃል ወይ ነው የሚለው።
አንዴ ትዝ ይለኛል በልጅነቴ ሆስፒታል ገብቼ ነበረ ከእናታችን ጋር ሄደን አንተ ትዝ አይልም ሆስፒታሉ ላይ ገብቼ ሰው መጥቶ እየጠየቀኝ ጎረቤት ምናምን ትዝ አይልም?
መቼ ነው እሱ?
ልጅ ሆኜ 15 ዓመት ምናምን አካባቢ እና በጣም ታምሜ ነበረ ትምህርት ቤቱን ለቀርቼ ምናምን አታስታውስም? በጣም ለረጅም ጊዜ
ድሮ ነው እሱ። ታዲያ
ያ ቢሆን እሱ የሆነ ከእሱ ጋር የሚያገናኙ ነገር ሊኖር ይችላል። ንገረው።
Yeah, no.
No past medical history?
It's fine. No.
All right, good. Can you ask him if he's ever had TB, you know, like a pneumonia for a long time, coughing, weight loss, night sweats, hemoptysis, lymphadenopathy, anorexia?
HIV ይዞ ያውቃል ወይ ነው የሚለው። No.
Has he ever
Okay, so Jocelyn and I thought that video was a very good example, be a bit dramatic, but a very good example of the risks of to safety and patient experience when you decide to use an interpreter who isn't medically trained or a family member to do the interpretation. So let's take a look at some other benefits of using interpreters when caring for patients. So there are many benefits of using interpreter services when working with families. And again, Catherine spoke about a few of them at the beginning, and we'll go a little into more detail about each of them. So when using interpreters for newcomers, there are benefits to safety. They result in a more effective use of time and resources. It's reported that there's improved patient and family experience, and there's improved health outcomes. And we're going to take a little bit more of a deeper dive into each of those. So when it comes to safety, when we use interpreters for newcomers, there's decreased risk of communication. Barriers are reduced to obtaining consent, discussing care options, and treating patients, which means more timely access to care. Jocelyn and I were trying to think back over our experiences here at CHEO and maybe some examples that we could share about patient stories where we felt that the use of an interpreter or not using an interpreter affected patient safety. And so we're going to share an example for each of the different benefits that we just listed. So the first one would be that we had a patient who was seen in the ED for difficulty breathing. No interpreter was offered to the family initially, so they provided as much information as they could to the physician in English. Unfortunately, they were not able to communicate that the patient was followed by respirology for reoccurring pneumonias. The patient was discharged home without a chest X-ray, only to return 3 days later with a pneumonia that required admission. Upon admission, the mother expressed that she felt the patient's care was delayed due to the miscommunication about his complex medical condition and fragile respiratory status. So moving on to look at the use of interpreters and how they result in a more effective use of time and resources. Interpreters really ensure that that message that is given is clear, concise in manner, and is easily understood by the family. This, of course, results in less questions and less need to repeat the message. And they also ensure the family's questions or concerns are heard and can be addressed by the care team. So think of an example here at CHEO in the last couple of years. There was a physician who was caring for a trauma patient in our resuscitation room, and they were trying to provide timely updates to the family. There was no interpreter available on site, but there was one en route, but they take 30 minutes to get there. In that time, the patient deteriorated and the physician was unable to spend the time required with the family providing updates, as the communication had been challenging, and so it was taking just too much time to speak to the family. This ended up resulting in poor communication with the family, ineffective use of critical time, and a breakdown in that therapeutic relationship, which is so important in urgent situations like that. And then moving on to the improved patient and family experience. So of course, the more the patient and family understand and the more they can respond, the more satisfied they're going to be with the treatment they receive, and really the more beneficial to that therapeutic relationship. Interpreters can also provide cultural support during an encounter, which can be invaluable. And again, think of an example from us. We had a patient recently who was from Ukraine, whose first language is Russian. They were admitted for a perforated appendicitis and required a prolonged stay due to complications afterwards. The surgeon presented to the room and to let the father and patient know that they wouldn't be able to be discharged as planned because he now needed to be NPO and required a central line for nutrition. The father was unable to comprehend the rationale for this prolonged stay and treatment and expressed some frustration to the surgeon and even considered leaving against medical advice. The surgeon attributed the frustration to the father being difficult, but of course, the root cause of this was just a poor communication because no interpreter was available. And then moving on to improved health outcomes. So we know that overall, when we use interpreters, we have shorter hospital stays, families have a better understanding of discharge instructions, and there's less risk of hospital readmissions. So our safety story that we shared at the beginning is a really good example of this. We thought we'd take a minute just to see if you have any other examples to share from your own experiences about any of the benefits that we discussed previously, or if you have other thoughts on other benefits of using interpreters for newcomers that maybe we haven't discussed here. And if you do, we'd love to hear about those too. So we can take a pause here to see if there's any feedback before we move on to the next slide.
If there are any examples that you would like to share, please put them into the Q&A box, please.
Thank you, Andrew. Maybe we'll just give a 20-second pause and then we'll move on. Is it okay if I move on, Andrew, or do you have anything there?
Feel free. There are no responses yet.
Okay, perfect. We can talk more at the end about this too. Putting people on the spot asking for stories. So we now really better understand the need and importance of interpreter services. We've talked about the how. We talked about the why. Now we really need to understand the how. So when Jocelyn and I were looking back on the last few years and on our services and how to make them better, we really realized that at the root of it all, we need to make sure our services are accessible. We need to increase the awareness relating to the need for interpreters, and we need to educate on services that are available.
And we do have a couple that have just come in, if you'd like me to go through them. Yeah,
for sure.
So some examples: interpretation services cost money, and most newcomers feel or have the thought that they cannot pay for it.
Very good point. Yep, for sure. And we're going to talk a little bit about that more in our tips and tricks for like when you're building an interpreter program. So absolutely, that is a barrier that makes it extremely difficult for families to access services they need.
Stigma or embarrassment.
Yep, for sure. Families wanting to try to get through on their own without needing the support of anyone else. Absolutely. And maybe the team members too, right? Team members who English is their first language potentially, but do speak a bit of French, may try also to try to work with families because they don't want to acknowledge that maybe they don't have the medical French required for the conversation. Good point. Yeah.
Repeat visits more often to check on progress if they can't rely on verbal reports.
Yeah.
One says, perhaps not new, but have experienced similar barriers and benefits in the community as a public health nurse, working with newcomer parents and families during pregnancy and postpartum.
Great.
Allows health service providers to meet legal and professional obligations related to informed consent. Professional interpreters support equity, safety, and accessibility. Thank you from Alana Carlisle, our interpretation services out in Winnipeg. A lot of privacy issues with families and friends, using families and friends, and also, as you shown in the example, alongside the miscommunication, the privacy issues there that could be shared with other family members, possibly.
Mhm.
One says, I find that many patients resist interpretation services either because they have basic command of English, French, or they have a family member who does. I've asked patients about this and they said they don't want a stranger hearing about their ailments, private information, even if they are professionals. What can one
Yeah,
do to
absolutely.
encourage them to use interpretation?
Oh, good questions. Great. Maybe we can talk a little bit more at the end about how we can try to make
course.
sure that families feel that they are welcome to use interpreters. That's great. Thank you,
course.
everyone, for contributing your thoughts and feedback there. So maybe we'll talk a little bit about CHEO services and what we looked like pre-pandemic, and then how we moved into a new model of care when we went through the pandemic, and so what we're doing now, and then where we want to move for the future. So while it can be difficult at times to find the positives from the pandemic, it did really result in us using some very out-of-the-box thinking on how to support families in a very different way than healthcare did pre-pandemic. Pre-pandemic, our focus was really on interpreter services being in person and making sure that we have phone services available. What this looked like pre-pandemic at CHEO was that we had about 45 independently contracted interpreters. We used third-party services as our backup. So if a CHEO interpreter wasn't available, we'd then go to our third-party services, which were a bit more expensive and of course less accessible than our CHEO ones. We only provided service really in person and by phone. We hadn't explored virtual care yet, and most services were pre-booked. We didn't have the ability to really have urgent needs met unless we went to the phone service. So then we went through the pandemic, and it really offered that opportunity for virtual services to be explored for families and shone a light on the possibility of a virtual interpreter service. We better understood the benefits of virtual care and how this can at times really reduce barriers to care. We were also quickly forced to learn about privacy, cybersecurity, and modify our practices to accommodate the virtual care in a safe, respectful, and private way. And so after pandemic, or throughout the pandemic, I guess, we added voice, which was an on-demand virtual service. We added the ability, of course, then to have virtual interpreter services available for staff and families. That allowed us to have services that could be pre-booked, but also some on-demand services. Instead of those urgent requests having to be made by just calling an interpreter, calling a third-party service, there was an app where an interpreter could be accessed via an app, which was much more efficient. We added some ad hoc training sessions for different teams to really try to do that education on services available and to increase awareness about the importance of interpreters and the need for interpreters. And then we added lots of training materials on our webpage, on our internal page, so that staff could quickly refer to those training materials should they need to, if they couldn't contact us with one of their questions. So just to give you a sense of what our services look like at CHEO, so you can compare a bit to what your organization may be experiencing, we have about 800 to 1,000 interpreter services booked each month, and that's been pretty consistent over the last 18 months or so. And then this slide provides a breakdown of our interpreter services by language, and you can see Arabic is by far number one. So the majority of services are in Arabic, and that's followed by Somali and then Spanish next. So what does our future state look like? Where do we plan on going from here? First, let's take a look at some things we've learned in developing our program, as these learnings are really going to guide us on where we hope to go next. And I'm going to throw it over to Jocelyn Lamont, who's going to take it from here and teach us a little bit about building an interpreter program and working with interpreters.
Thank you very much, Jill. Good afternoon, everybody. So when you're building your program, we think it's important, and it's been said as well, that 24/7 services are a key component. This ensures equity and of service provision. The introduction of voice here at CHEO has been key for us in this area. In-person interpretation is always best if possible, so maintaining a large number of interpreters with various languages and dialects is important. This can be done according to your own needs. At CHEO, we have 11 Arabic interpreters, including a full-time Arabic interpreter who is available on site, and we meet the needs of our families from Nepal by having 2 Nepalese interpreters in our overall pool of interpreters. Again, the availability of service in many modalities, in person, virtual, and by phone, is important. As we continue with a few more tips, I wanted to highlight centralized cost. Having costs centralized and not allocated to individual programs prevents different approaches in using interpreters and helps ensure equity for all patients. It is also not a challenge for staff who may be hesitant to incur the cost of having an interpreter while trying to be mindful of cost or find cost-cutting measures in their program. Equally as important is that there should be no cost to families, as this could definitely present barriers and impact equity of service. Before the next slide, how many of you have virtual services available in your organizations? Andrew's going to do a poll, I think. Take a couple minutes here. Andrew, let me know when you're ready.
Yeah, we have about 81%, 83% of the audience has responded. Would you like me to end the poll?
Sure. Oh, wow. So this is good as well. More than half of you. Okay, well, I'm going to continue on now. With the virtual interpreter services being new to most, we thought we would take a couple minutes to drill down a bit into these virtual services. Here are some tips. Barriers that may seem minimal can be a deterrent to staff accessing services in urgent situations. This is often when interpreters are needed the most. To reduce barriers to accessing interpreters, consider the following. Have designated devices for virtual and phone interpreter services. Mount electronic devices on carts. Consider the size of the screen, especially if it's being used for sign language interpretation. A good sized screen can also feel like there is another person in the room with the patient and the service provider. Keep logins for electronic devices simple if you use them at all, and ensure the devices are readily available. We know that technical challenges can happen. If you're me, they're almost guaranteed. And so it is important for you to make sure that you know how to get back in touch with your interpreter if the connection is lost. It is one reason, considering the strength of your internet signal may be an important consideration for using virtual service. And while virtual services often provide a solution to on-demand interpreter needs, keep in mind that in-person interpretation provides many things that virtual services cannot. Consider using in-person services should the support be required for an extended period of time. Here's an algorithm that we developed when we started to offer virtual interpreter services. The goal of the algorithm was to ensure that staff continue to consider in-person services when the need is there. You can see that voice is recommended in urgent situations and when the need is brief, but in-person is suggested for ongoing care needs. So back to where are we going, our future state. After working through the pandemic and benefiting from many learnings, we developed our work goals, our work plan and goals. As Jill said, accessibility, awareness, and education. In an effort to make services easily accessible to staff and reduce barriers to booking an interpreter, we are currently transitioning to a centralized booking process. This removes the work from frontline staff to be booking interpreters and also ensures that interpreters and our third-party services are used equitably and appropriately. We hired our first full-time interpreter as of mid-September. This will also help reduce barriers to accessing services and provide a more rapid response for in-person interpreter needs. While we have done lunch and learns previously, they were not done consistently, but with our new full-time interpreter, we are hoping to be able to do these on a more consistent basis. These sessions will cover the value of using interpreter services, provide training on working with interpreters, and also review the booking processes. To centralize services even more and reduce barriers further, we are exploring the ability to book interpreters using a calendar in the electronic health record. This also allows for documentation of the interpreter information in the patient chart for ease of following up with the interpreter should it be required after the visit. This can be for billing questions, but it can also be for contact tracing, which was a need that was once again highlighted during the pandemic. iPads are another way to reduce barriers to accessing interpreters, and so the more available, the more likely staff are to request the support. Having iPads that can be signed out by families during the visit is even better, allowing the family to have an interpreter with them throughout their visit. Whenever programs are being developed, there is also a need always to have constant learning. We live in an ever-changing world with new services and technologies popping up every day. It is important that organizations stay up to date with best practices and new and exciting ways to communicate with families. So I'll just move on to a few tips now for prepping appointments. So having interpreters appropriately prepped for appointments is shown to improve the overall safety and experience for the families. This is an area where at CHEO we are hoping to improve through our lunch and learns. Having the correct dialect and ensuring that this is the case will help decrease the instances in appointments needing to be rescheduled, because this is a language barrier with the interpreter and the patient and patient family. Giving the interpreter a list of medical words you will be using ahead of time is helpful, so the interpreter can learn them and find equivalent words and phrases. This is especially useful for specialized and obscure conditions. And briefing the interpreter on the appointment's purpose and what you hope to accomplish is also important. As we continue with tips for prepping, something that's important is to prepare the interpreter if the appointment is going to be particularly emotional or intense. This is only fair, as the service provider is aware of what news is coming, and it makes sense that the interpreter would also be aware so they can prepare themselves to remain neutral. Many of our interpreters get to know these families very well, and they assist with appointments over many years. Planning in advance for the interpreter to let you know if the conversation has become too much for the patient or for the interpreter is also valuable. As we know, sometimes there is the death of a young patient. One of the things we would notice here at CHEO is that staff have access to support through PEEPS, which is our Peer Emotional Empowerment Program of Support. And in the event of a death, there's also typically debriefs for staff, but the interpreters are not currently part of these. And so this is an area that we hope we can better support our interpreters with, as they are also involved in these challenging situations. Interpreters are communication specialists, so it is important to respect the interpreter, but also to be able to point out if they are not appropriately performing their role. And the interpreters should feel comfortable asking you to slow down or for clarification if it is needed. Ask the interpreter to teach you appropriate greetings and name pronunciation. This may seem like a small thing, but initiating the therapeutic relationship by ensuring you correctly pronounce the patient name and greet them in a way they understand goes a long way in establishing trust. Now I'm going to just move on to a few tips for working with interpreters. Some key points of what you can expect when working with interpreters is that they are used to facilitate communication between two parties. We expect them to introduce themselves to both parties and also to get permission from the patient or family to interpret. They have signed confidentiality agreements and must maintain patient confidentiality. It is also important to note that they are obliged to interpret everything that is said, and this includes any side conversations. They also use the first person when interpreting. If a patient says, "I don't know," the interpreter responds, or the interpreter interprets this as "I don't know." They do not say "she doesn't know." A few more tips on working effectively with interpreters includes remembering that you speak through the interpreter, not to the interpreter. So remember to face the client. Speak slowly and clearly, but not too slowly or loudly, just like we saw in that video. And remember, there may not be a direct equivalent term in another language. It can sometimes take longer and a few more words to convey unfamiliar concepts. In the next slides, we have another video for you, which nicely summarizes what we have just said. While it is only about 10 minutes in length, we're only going to show you a snippet of it, but we thought it could be something that you may wish to use and or be useful to share with your teams.
For convenience of remote parking, secure your Kia Niro.
Just going to stop sharing for a second to get to the right video. Sorry, everyone. Start sharing again. Jocelyn, can you see the screen okay there?
Yes, but your side screen is up also. The next slide screen.
It's in presentation mode or presenter mode.
So the wrong screen then? One second, yeah. I'm sorry.
That's all right.
This is the test of my technological abilities.
There we go.
Yeah, okay there?
Yep.
Although this may sound overwhelming at first, using an interpreter is a skill that must be practiced. It will get easier with every appointment in which you use an interpreter, and ultimately saves you time and makes you a better medical provider. Research has also shown that using an interpreter increases patient satisfaction, increases patient-reported health status, increases adherence to medication and follow-up visits, and most importantly, decreases the risk of dangerous misunderstandings.
So that's a really good video. I really do suggest that you have a look at it because it really does encapsulate a lot of the things that we've talked about today.
Sorry, Jocelyn, I was trying to get it stopped. My fingers were
That's okay.
All right, I'll share again. You can see screen again, Jocelyn?
Yes.
Okay,
yes, thank you. So then next slide will be a list of the resources that we have used in putting this presentation together. And just before we open it up to the Q&A, we thought we'd have one last poll for fun, because we wanted to know how many of you are feeling more energized and excited to continue the work you are doing with interpreter services. So yes, you are. No, you're not.
No pressure, right, Jocelyn? And I'm answering here.
And with that, we have about 3/4 of the audience responding. Would you like me to end the poll?
Yeah, sure. Great, thanks. Good.
No, only 7%. That's good.
Perfect.
Excellent.
Do you want me to stop sharing, Andrew?
Yes, please. And we can jump right into our Q&A. And excellent presentation. Thank you, Jocelyn and Jill and Catherine, for an excellent presentations today. So going through, we've got quite a few questions from our audience. Our first one is, how do you ensure that providers use the interpretation services available to them?
That is a great question. Do
Yeah.
you want me to start, Jocelyn?
Sure.
I'll start and then you can jump in. I think part of that is awareness and education, really making sure that the services are easily accessible and that they know about them. They know about the possibility of using them. But the other thing I think that's important in our electronic health record, when you go to register a patient, it has what their preferred language is. And we do have a policy here at CHEO that if their preferred language is anything but English, or French, then we should be getting an interpreter to provide language to them in their preferred language. So for us, that really makes it not a decision point for a provider, but if the preferred language is Arabic, we get an Arabic interpreter. And I think that also reduces barriers for families and makes it a bit less uncomfortable for families because we're not relying on them to ask for an interpreter, but it's assumed one is needed until proven otherwise in our organization. Jocelyn, anything else that you can think of there?
That's exactly it.
Excellent, excellent. We have a couple variations on the same sort of question, so it'll be sort of like a three-parter. I guess the first one being, how is CHEO's health interpretations funded?
Yeah, so in terms of like the model, like all of our interpreter services are paid for through patient experience. Does that answer that question? Is that what they were looking for? So CHEO pays for interpreter services. We have one central budget that we use for that. And so anytime an interpreter is booked, it's paid for through one single cost center. And as Jocelyn was mentioning, that really does result in not having to have individual clinics and services paying for their own interpreter services, and therefore sometimes finding workarounds to save budget. We don't ever want the risk of an over budget department not using interpreter services, so a centralized cost center is used. Does that answer that question, do you think, Andrew?
I believe it does, yes.
Okay.
And then following up to that question, how would smaller clinics and smaller pharmacies access interpretation services, and how would they be able to fund them in sort of, are there any sort of government-based, sorry, question moved. Are there any sort of particular funds available for small service providers?
Oh, it's a very good question. Can I see if Catherine has any thoughts on that one from an N4 perspective? We're lucky because we're obviously funded by the Ministry of Health, so it's a little easier for us to, use some of our CHEO funding for those things. But that's a good question about whether funding is available for smaller clinics, things outside of the Ministry of Health funding.
Thank you so much, Jill. I think that is really the key advocacy work N4 is trying to do, is to ensure that those points of care outside of hospitals and outside of larger organizations are able to access interpretation and have those funding. I would turn to our template letter for you to write to your political members to encourage for you to write and give them awareness of that is not currently funded. In the Ontario model, it isn't currently funded, but across Canada, there are different provincial structures in terms of how they deliver care. And we know that, for example, in Manitoba, all access of care is provided under their interpretation services. But unfortunately, on Ontario, so it depends on where you're located. But unfortunately, in Ontario, that is not something that is provincially funded at this time. But hopefully, it will be soon.
Thank you, Catherine. Thank you. One of our questions that we have, do you have any tips on how we go about clients with low medical literacy levels? So those that require more layman terms in receiving information regarding their condition. And do interpreters have the ability to provide that sort of more layman terms in their language?
I want to take all the questions here, Jocelyn. My thought on that is that really shows the importance of that huddle before the appointment, so that if the care team knows that the family might benefit more from something like that, that's a conversation that happens ahead of time, or the interpreter in having conversations with the family ahead of time, as they walk to the clinic or prep for the appointment, also may have that realization, and then connect with the care team to really figure out how to modify the appointment so that it's, at the appropriate level for that individual. Interpreters are trained to use medical terminology, but they also have the ability to reword things as necessary, and find ways to work with the care team members to have it reworded in a way that is more easily explainable to families. So I think that highlights to me the importance of that prepping, and to, if an interpreter isn't feeling an appointment is going well, to pause for a second and let the clinician know, again, allowing that chance to re-examine the communication strategies and readjust as needed. Jocelyn, anything to add on that?
Yeah, no, I think that's great.
Okay.
And I believe we have time for one more question. How do you become aware of issues that result from miscommunication or lack of interpretation, and what sort of follow-ups happen?
That's a great question. So that can happen many different ways, actually. So we've had families reach out to us in our interpreter services program, or to patient experience with concerns about work they've done with an interpreter. Of course, they were using an interpreter at the time at a different service. And so when we are flagged about concerns with an interpreter, we would then follow up with that interpreter or with a third-party organization that employs that interpreter to provide that feedback. Sometimes we hear it too from the clinicians themselves. So I've had calls from clinicians where they felt that the interpreter service wasn't the highest quality it could have been, and so they expressed some challenges that they had. And again, that's a conversation we would have with the interpreter to really get to the root of the issue. Interesting though, one of Jocelyn's points was how Oftentimes a clinician will say one sentence and an interpreter has to reword it in different ways to try to get the same message out. And what I have found before is clinicians might reach out to us and say that their concern is the interpreter isn't interpreting exactly what is being said. And when you actually have a chance to debrief with the interpreter, it's that what the clinician was trying to express, there was no way to interpret that in that language. And so they had to try to find a workaround and explain it, in a longer format to really get the message across. And so oftentimes, even some of the feedback we get when we hear from the interpreter, it allows us that loop back with the clinician to explain again, it wasn't really that the message wasn't being given exactly as it was being spoken. It was that it had to be said a couple different ways to get the message across. Jocelyn, anything else to add there? Stealing them all.
I defer to you.
Thanks.
And with that said, I'm just taking a quick look if we have any quick questions. Do you have a link to check where funding clinics are located, and is there a certain process to access said funding? After we send this out to the folks, is there any potential links that can provide more information on funding opportunities?
Catherine, question maybe more from an N4 perspective. Okay.
Yeah, thank you so much. I'd be actually also curious about that answer, and I'll do research. And if you'd like to email me, I can get back to you on that. Whoever wrote in I can put my email in the material to go out afterwards.
Thank you, Catherine.
Mhm.
And looking at the time, I believe we've have gone through the full hour. So thank you again for this presentation, both Catherine and Jill and Jocelyn. Let me just share my screen.
Follow up on one quick thing, Andrew, that we talked about at the beginning, we said we loop back on, and that was just the how do we make sure that families feel comfortable accessing interpreter services? Because that actually is a very good point, and I'd love to hear from others that are on the call too about that. But I think Joss and I would probably say that it's really trying to make sure that the families don't feel like accessing an interpreter is a burden. And so having standard processes in place where an interpreter becomes an automatic thing, unless, again, requesting that they're not used, I think is one way to do that. So it's really about making the families feel like they don't need to ask for it, it's just going to be there. And also the other way to make them feel more comfortable with interpreter services is that continuity of care. And so that's something that we try to do here. I mean, our pool of in-person interpreters is small, there's 40 to 45. But whenever possible, if one interpreter is working with a family, oftentimes we do add a little note to the chart that that's their most often used interpreter. And if they have a good relationship with them, they try that one first the next time that they book. So we don't automatically, pick the most senior interpreter. We try to find the interpreter that's the best fit for the family.
Thank you,
Sorry,
Jill.
just wanted to loop back on that because I said we talk about it at the end.
Excellent. Thank you. And thank you for that. Thank you for taking all the questions that that our audience has provided. And thank you so much for the work that you do at CHEO. And again, thank you as well, Catherine, Jill, and Jocelyn. Just to bring forward, we do have our checklist for recruiting, integrating, and retaining IHPs that is available on our website. Alongside that, we also have our N4 Biennial Stakeholders Survey that is available to those in the audience today, as well as those that are watching this on recording. Our surveys are available here at newcomernavigation.ca/survey ou newcomernavigation.ca/sondage. It takes about 5 to 10 minutes to complete, and we very much would like to hear your thoughts on the various opportunities that we provide. Along with that, thank you very much, Jill, Jocelyn, and Catherine, for taking time to participate in today's discussion, and many thanks to you, the audience, for joining with us and engaging with us today. You're very much welcome to join any of our upcoming webinars here or through the QR code or newcomernavigation.ca/upcoming. As well, you can watch the free on-demand webinars as well, newcomernavigation.ca/on-demand. And if you missed any part of today's presentation or would like to watch this session again, we will be posting this recording to the N4 platform within the next week or so. And we want to continue the dialogue that this presentation has started. We'll be moving all the questions that we didn't get a chance to address to N4's online moderated discussion forum called the Meeting Place, and we'll be following up with Jocelyn and Jill after the webinar has concluded with the questions, just to review and check what their thoughts are. And along with that, We've invited our presenters to respond to your questions there. We've also curated several resources related to today's presentation topic, and you can find these in our resource toolkit, and we will link them when we share the on-demand version of this discussion, the various different supplementary resources that were available in the slides that were presented today. Following this session, you'll be invited to complete a brief survey to share your feedback with N4 as well. These surveys help us continuously improve and seek out new webinar content and opportunities that are responsive to topics you're interested in. We kindly ask that you follow the link and complete this brief survey. Along with that, feel free to check out our N4 mobile app, take N4 on the go with you. Check out all our resources, our toolkits, our educational opportunities. Heck, you can watch this webinar on your phone, on the bus, on your way to work if you feel like it. Feel free to check it out at newcomernavigation.ca/iOS or newcomernavigation.ca/Android. And once again, thank you, Jocelyn, Jill, Catherine, and everybody here that has been able to come to the webinar today, and for those that are watching this in a recording. Stay safe, stay well, and we hope you can join us again at a future N4 event. Take care, everybody.